Hi, my name is Hunter, and today I will be performing administration of an intramuscular injection. So for this skill, we will need our syringe and needle, a gauze pad, alcohol prep pads, our medication vial, our patient, and then our gloves. So the first thing that we want to do is gather our supplies, which I kind of touched on already, but with that, we are going to be, in our medication vial is going to be morphine sulfate, 1 dose, 6 milligrams, administered intramuscular. And then we've got our 3 ml syringe, and then we've got a 22 by 1 by half gauge needle, and then alcohol prep pads, and I think that's it for our skill. And now we would want to make sure we had a band-aid if we felt like it was necessary. For intramuscular injections, we generally do put a bandage on. So we will kind of move into our next step. So we always want to, when administering medication, we always want to make sure that we verify the 6 rights of medication and verify the medication dosage and medication to the MAR 3 times. With the 6 rights of medication, so being right patient, right med, right dose, right time, right route, and right documentation. After that, we want to go ahead and calculate we want to check the medication to the EHR and calculate the appropriate dose. So I did do, I don't do dimensional analysis, but I do the desired over half. So desired is 6 milligrams. I don't know if you can really see that. There you go. So the desired is 6 milligrams over what we had on hand, which is 4 milligrams times the 1 ml, which is 1.5 mLs we're going to be administering to the patient. So we will go ahead and enter the patient's room, or take our supplies, enter the patient's room, close the door behind us to ensure patient privacy. We will perform our hand hygiene, introduce ourselves to the patient. Hi, Mrs. Smith, I'm Hunter. I'll be your nurse today. Your provider has ordered a medication injection today. Can you go ahead and state your first and last name? Okay, great. And then your date of birth. We always want to make sure that we identify the patient using 2 identifiers. So once we have identified the patient, we then want to ask the patient if they have any allergies. Mrs. Smith, do you have any allergies? No? Okay, great. So then we would go ahead and move into talking about the medication with the patient. We would talk to her about the mechanisms of the morphine sulfate, the side effects, and then any adverse effects. So the mechanism of the morphine sulfate is going to bind to the central nervous system, and they are going to alternate receptors of the pain stimuli. So it acts as like a pain relief, a pain relief medication. The side effects of the medication could be nausea or constipation, and then any adverse effects, and now these are things that we don't want to happen, so if they are to occur or happen, we would want to know immediately. And that could be tachycardia and or feeling like you're going to pass out. So if any of those happen, you please let us know, and we will notify the healthcare provider and take care of that. After that, we always want to ask the patient if they have any questions. Mrs. Smith, do you have any questions? No? Okay, great. So then we would then want to move into performing our hand hygiene, putting on our gloves. So we'll go ahead and do that again. Okay. We're going to go ahead and put on our gloves, and then we are going to draw up our medication appropriately, and then we're going to locate the site, and then we will go ahead and administer the medication. So we want to, when we are administering the medication, we want to again double check it against the MAR, make sure that we have the appropriate medication, and then the correct dosage. So it's the second time. So we're going to go ahead and wipe the top here. Okay, we're going to go ahead and attach the needle. Okay, now with the cap still attached, we are going to draw up 1.5 mLs of air. We're going to go ahead and, holding it like a pencil, we're going to go ahead and inject this air into the medication vial, and then we are going to invert and withdraw our medication. Okay, we're going to leave that there so we can do a scoop method. Okay, invert. And if we are to have any air bubbles, we gently tap and it will work them out with the plunger. Put it in there. Okay, there we go. Gently tapping to get them out. Okay, so we're going to go ahead and put our medication over here, and we're going to cap this using the scoop method. Okay, now we are going to go ahead and locate the, so we're going to set this here. Sorry, I'm trying to make sure I can see everything. So now we are going to go ahead and move into locating the site of the patient we want to inject. So after we've verified it, again, we are going to then, I guess I should say there are 3 locations that we can inject. So one being the deltoid, one being the vastolateralis, which is like in the quad region, and then the ventrogluteal. And we are going to administer in the ventrogluteal today. So when we are identifying it, we always want to make sure that we palpate and note any like lesions or bruising, edema, anything that might be concerning for injection. Make sure there's any masses. So when we identify it, it might look weird in my angle because my non-dominant, but maybe not. So when we identify the location, we want to put the heel of our hand on the greater trochanter, right? And then we want to put the thumb towards the growing, or down towards like the growing area. And then we want to place our index finger and our index finger is going to go towards the iliac spine, and then like the middle hand area is going to go towards the buttocks. And so it's going to create like a V for us. And we want to administer it right in between that sweet spot. So it's going to be right in here. Okay. Right, so we have identified that. Now we are going to go ahead and alcohol wipe. And we're going to start from the middle and work our way out 2 inches. And then we are going to let this dry completely. We never want to blow on it, as that could recontaminate the area. Now if we were to touch it again, or we were to re-identify like the location, we would certainly want to re-sanitize it. So I will go ahead and show this dosage, kind of difficult to see. Before we administer, we will go ahead and hold the syringe between our thumb and our index finger, and we're going to hold it like a dart. And what we're going to do is we're going to we're going to go ahead and take the cap off, and we are going to position So the non-dominant hand, we're going to use the thumb and the forefinger of the non-dominant hand after we've placed it in that area to stretch the skin. And gently grasp a muscle to increase any muscle mass. Now we are going to position the ulnar side of the non-dominant hand and hold it in position to inject the medication. And when we do this, we want to release the after we inject the medication, we want to withdraw and then release the skin. So we'll go ahead and do that, okay? Okay. Okay, holding like a dart at a 90-degree angle. Okay, and now I'm going to take these two fingers and I'm going to stabilize the barrel. And if we were to aspirate with intramuscular injections, we would go ahead and do that. We would withdraw and we would aspirate as needed. So I'll go ahead and do that. Okay, there's no blood, which means that we are in the muscle, so we're going to go ahead and inject. And we want to do this at a rate of 10 seconds per ml, so making sure that's okay. And then after we have completed this, after we've injected the medication, we want to hold the syringe in place for 10 seconds, and then we want to slowly and steadily remove the syringe and release the skin. Okay, it's been 10 seconds. Okay, and then we're going to gently release the skin. Okay, and then we are going to immediately place this in a sharps container in the appropriate receptacle, and then we are going to place gauze over the top. And we are going to gently press but not massage. We never want to massage that area. And then after that, we would make sure the patient is okay. We'll go ahead and remove our gloves. Okay, and then we would place a bandage as needed. If it was necessary, most intramuscular injections are band-aids are placed. So then we would go ahead and remove our gloves, perform our hand hygiene, make sure our patient was okay, and then we will go and document our findings.